It's been busy with me. I am Leanne Rowan, student number 452941354. This activity is for the purpose of assessment only and will be recorded, viewed and stored following TAFE Queensland procedures. All participants consent to being recorded for these assessment purposes. Good afternoon, Joe. This is Jim. Jim is a compliance officer who assesses my performance regularly to ensure I'm both meeting my obligations and improving.
You undergo reviews like I do as a CSW?
Yes, all workplaces that work to a code of conduct will have regular compliance or performance reviews to ensure staff are meeting both the business goals and the employees' goals. I can see how well you have taken the review and worked with it to improve your actions and the outcomes of your placement for all involved. This shows you will engage in this form of process readily in the workforce. I have a copy of your updated work plan to run through and confirm the changes. Please note that I will use this to update the court. I've already notified them there will be an amendment and they will work with us to achieve this. Do you have any comments on the program?
Your team and base services have been really good at helping me with managing my symptoms in the workplace. It has surprised me. Is there any way to help with this at future roles? I really want to finish this placement and move on to hospitality, but I'm concerned about my symptoms.
This works well with suggestions Jim has for assisting you. To meet both the QPS Code of Conduct to provide respectful engagement, which is Principle 1.1, fair courteous service, which is Principle 2.1a, providing an integrated service, Principle 2.3, a commitment to continuous improvement and innovation, Principle 4.5, and the Queensland Corrective Services Strategic Plan to reduce recidivism and provide opportunities for our CSWs. We connect CSWs with services to assist with improving their outcomes post-placement.
No wonder you know the principles I'd struggled with the meeting. You trying to achieve them when you work with me. You really do apply these every day.
Leanne does. At times she can adjust her methods, but her whole team at QCS and the Compliance Office help to ensure she can achieve this. We all help her to achieve these goals. No member of a team is ever alone in achieving the goals of the business or their own goals. We can all see, Joe, that you have shown great improvement this week and that you wish to complete the placement and move along to other opportunities while managing your health concerns.
The programs that may help include mental health services to assist with your anxiety. These will work well with your doctor to help you.
Does this involve a mental health plan? Doc mentioned this last visit.
I believe so, but the important thing is that you've already spoken with your doctor on this. I would advise you talk with him further on this.
I have an appointment next week after placement finishes.
That shows you're determined to improve, which is excellent. Another service we can connect you with is quit smoking programs. They provide assistance in quitting and developing other ways to cope healthily with anxiety. I've done some research and often when parents have ADHD and anxiety issues, children will do as well. Research shown ADHD is hereditary and as anxiety comes as a comorbidity with poorly managed ADHD, it's likely that this will exist in your children as well. This means that modelling healthy coping methods may help your children to develop appropriate methods as well.
Can I do this with my doctor?
I believe they can help with this. After this meeting, I will send you a follow-up email, which will have another copy of your work program, as well as information and links for possible services. If you would like our help in connecting with them, let me know.
Thank you.
Leanne has some suggestions for post-placement options for employers, which she will mention in the email, but which may be best discussed with prospective employers, as it is funding and support services for them. There are also services to assist you should you have difficulty in adjusting. We will also need a copy of your medical certificate. This will act as proof to the court that as a team, you, the base and the corrective service community service team are working to assist with your health management to achieve the community service order requirements.
The base services team have told me how well you have been working with everyone. They are happy to complete the placement with you. They were impressed that you were willing to talk with staff and volunteers and explain your condition. It has helped them with some of their patrons, who they now realise may have similar conditions. They are interested in doing some training on working with people struggling with these conditions and how to assist them in attaining the services they need. There has been agreement to work in with the volunteer medics on this. Thank you for being candid. This demonstrated how your effective communication assisted in the service improving its own outcomes and those of its patrons. You are applying the Code of Conduct principles each time you act appropriately and ethically.
Were these the areas I had done wrong before?
You hadn't done all areas wrong. In fact, you'd done some very well. But it was just a quick demonstration of how easily you can achieve the Code of Conduct by communicating effectively. I can detail the individual standards for you in the email.
Just provide the numbers. I'll reference the documents you gave me.
As a formality, I must mention, if you were to show an unwillingness to comply with the Community Service Order, revised program and codes of conduct, it may result in the court revising your case and incarcerating you. I don't think we're heading down this path, as you have shown a commitment to completing the program, but I must mention it so that you're aware of what may result should you regress.
As I've said, I will complete the order. With my partner in hospital and needing recovery time afterwards, the family need me to be responsible and available, something I cannot be from a jail cell. I would appreciate some help. That Jim mentioned with adjusting after the placement, I need help with managing my time and responsibilities if I'm going to study and work.
Please don't stress about that. We do have some options for that, and many registered training organisations and apprenticeship and traineeship facilitators have services to assist with developing these skills. I will investigate this further and provide information at your exit interview.
What is an RTO, training organisation?
Sorry about the jargon. This is a good demonstration of how confusing jargon can be, but you have done the right thing and asked for clarification. A registered training organisation are approved by the Australian Government to provide educational services in particular areas of study for vocational education and training. Vocational means career pathway. TAFE is an example of an RTO. Does that help?
Yes.
To assist you in the base services, I will meet you at work each morning. This way you can communicate any difficulties with me each day and we can fix it quickly. I will also be in touch with the court to update your file and program. They need to approve this change, but this should not be a problem as you will provide me with the medical certificate to support your health needs, and I have some paperwork for us to sign to update your work program. This includes an application for amendment, revocation of a community-based order, which is Form 38 of the Penalties and Sentences Act and the Penalties and Sentences Regulation. To this, I will attach your adjusted community service order work order program. I have a copy here which I will ask you to countersign as confirmation that you've agreed to the adjusted program.
We have confirmed that this is okay to hold till after your doctor's appointment. The court will accept that you are moving forward with the program and formalise the program on receipt of the Form 28. They will then provide a notice of amendment revocation of Community Base Order Form 37, Penalties and Sentences Act. This formalises the new program and allows you to complete the program. Please note, as Leanne said, if you do not comply with the new order, the court will issue a revocation of the order and the court may order incarceration.
Thank you, Jim. Do either of you have any questions or further comments?
No.
No.
I think we've covered everything. If you have any further questions, let me know on Monday. My understanding is your doctor's appointment is tomorrow. If you could bring the medical certificate on Monday, I will submit the paperwork on Monday morning. Thank you both for having this conversation. Have a great weekend.